Our next guest is Dr. Ben Browning from Novant Health Orthopedics and Sports Medicine. How you doing today?
Doing good, Jen. How are you?
Good to have you.
Thanks for having me
so
back.
happy you're here. Well, thanks for coming back on the show. I know you've been here a few times, and we're really happy to have you again today. So we're talking about, our whole show is about orthopedic medicine today, including the physical therapy piece. So tell me about your focus areas in orthopedics.
Okay. My training, I'm an orthopedic surgeon, did subspecialty training in sports medicine and arthroscopies. So my practice revolves a lot around minimally invasive arthroscopic surgery of the shoulder, including rotator cuff tears, shoulder replacement, shoulder instability and complex shoulder reconstruction, as well as arthroscopic surgery of the knee, meniscus tears, ligament reconstruction, all those sorts of things.
That's a lot of stuff.
Yeah, in addition to the operative stuff, obviously a lot of sports medicine injuries are non-operative, so we do a lot of physical therapy as well as injections for a lot of other treatments.
Yeah. So the question says, do you, what kind of patients do you treat? So that kind of covers a lot of different kinds of patients.
Yeah, pretty wide range, and a good majority of injuries are non-operative, so we see quite a wide range of injuries.
Well, sometimes when I think of sports medicine, I think of like athletes, you know, really runners and just very athletic kinds of people. But it's much broader than that, right?
Oh yeah, absolutely.
Yeah. Well, talk to me about what sports medicine entails.
Okay. So really any injury revolving around either a true like sport, whether individual or group sport, as well as injuries just revolving around working out. And so it covers really a wide range of injuries as well as sports, whether it just be simple muscle strains, muscle tears, rotator cuff tears, contusions. And so sports medicine encompasses both the treatment, surgical and non-surgical, for each of those injuries, as well as injury prevention. And so it really encompasses.
Yeah, we'll talk about that prevention in a little bit. Specifically right now, let's talk about children and teens and sports. So are there, at what age do you, in your opinion, is it okay for your kids to start playing sports, whether it be soccer, football, and maybe it's different for each sport? I'm not sure.
That's a big debate. In terms of, there's not kind of a one-size-fits-all answer. Generally speaking, there are some guidelines saying that the original kind of school of thought on it was organized sports maybe somewhere around ages 6 to 8, and maybe not prior to that. Now there are some organizations which limit games and practices and things like that for ages as young as even 3 to 5. So it really just depends on where you're playing and what you're playing.
Some kids can't even walk at the age of 3.
Exactly. And so the reason why they give guidelines on it is just because of overuse injuries. And so generally speaking, they typically say, if you're going to play a sport, don't really play a single sport, for the entire year. Try and limit it to less than about 8 months out of the year for that sport, and limit the number of hours that you're doing it to the number of years of age that you are. So if you're, an 8-year-old, not really playing a single sport or doing a single activity for more than about 8 hours a week.
So I know some kids who go from one sport to the next, depending on the season. Is that okay?
As long as they're switching sports where you're kind of working different muscle
different
groups.
Muscles.
But if you're doing a lot of the same stuff over and over is where we start to see a lot of those overuse injuries.
Let's talk about sports physicals. I know that a lot of the schools do sports physicals, but I'm not sure what that means. Does it just mean the systems, or does it talk about, do they usually look at knees and elbows and things like that?
So really kind of a head to toe, it's a quick check. It's really, the main intention of it is, number one, to make sure that you're healthy enough for getting out there and playing that sport, as well as a good screening tool to screen for some serious conditions that maybe haven't been picked up, prior to that.
I've heard of that.
Because I know sometimes it's not until you're playing a sport that you pick up on some of those more serious ones.
Okay, let's switch to adults. So I'm curious what sports in adults cause the most injuries. I would think it would be running, but I'm not the expert here. You are. And then there's so many people playing pickleball, and so I don't know much about that, but it seems to be really popular now, and I think it's a little easier than tennis. Um, but so talk to me about that.
Okay. As far as which ones are the biggest cause of injury
Yeah.
by age, it really just depends on really where you are, in the world, in the nation. There are some sports that are more common in particular areas. Generally speaking, basketball is one of those that has a lot
Really?
more injuries in terms of hand injuries. You think about, there's lots of small little finger injuries, fractures, sprains.
I would have thought
strains.
ankles.
Yeah,
All the
both. Yeah, and the knees.
pivoting
And
knees.
really, the skill set that basketball requires, that one seems to be one of the higher ones. But generally speaking, it just depends on what's popular in the area. Rock climbing, next to a beach is not a very common injury. But if you get up to like Colorado, then that's probably
Yeah.
a little bit higher there. The area that we're in, there's lots of people who are older in age, but physiologically play a lot of sports as if they're 20, 30 years younger.
Yes.
And so being a lot more active, we see a lot of similar injuries in them that we would see in 30 and 40-year-olds as well. So it just depends on your activity level and which sports you really enjoy.
Is pickleball easier on the body than tennis?
If you're playing it probably like it was originally intended to be played. However, I see a lot of people who very aggressively play it and get very competitive.
Okay.
So depending on who you're playing against and
see.
how competitive you're playing, we see a lot of injuries from pickleball.
Oh, really?
Oh, yeah.
I heard it described as the old person's version of tennis.
I heard that originally when I learned about it, but I think there's a lot of prior
Very
tennis players that get out there and play it like it is tennis.
Very aggressive. Well, let's talk about the patient. It's your first time patient, and they're just walking through the office. Tell me about some of the most common injuries or complaints that you see.
So a lot of the most common things that come in are shoulders and knees. So shoulder-wise, a lot of muscle strains, rotator cuff tears. Outside of that, knees, usually meniscus tears. We do get, your normal wear and tear type stuff like arthritis of the knee and the shoulder, but usually more activity-related sort of stuff.
You see a lot of shoulder issues based on their golf swing?
Yeah, again, if you're just getting started at playing golf, if you've never played it before, maybe not have the best technique or instantly hit the ground during that swing, even if you've been playing it for 30 plus years. So in both those situations, obviously, we see a lot of muscle strains as well as tears. Not always, your normal wear and tear type stuff with arthritis. It really just kind of depends on the individual and kind of how active and how much they've used each of those joints.
Yeah. Do you see weekend warriors, I call them?
Oh yeah, absolutely. I think that's
They go out there and just
I think in our area, I think it's more like weekday warriors, not just on the weekends.
I'm curious about age. Do you see certain age groups tend to have more of one kind of injury than others?
So as people get a little bit older, we do have the normal wear and tear type stuff like arthritis. But again, that really just depends on the individual. Like I said, we do have a really active population in the area. And so a lot of them, retire early and, are out enjoying life. And so they spend a whole lot more time playing sports and things that they did, 20, 30 years ago. And so do see a lot of injuries, in 60 and 70-year-olds, exactly the same as our 30 and 40-year-old patients.
Really?
Yeah, absolutely.
And there are a lot of 60 and 70-year-olds out there, and they don't look it, and they don't act
Right,
it,
right.
and that's why.
And that's where it's important because you certainly have to know, what their goals are and what their activity level is because, the treatment plan from one person to the next, should really be individualized there.
Wow. Well, that's a lot of great information, Dr. Browning. I'm so happy you were here today. Are you taking new patients?
Oh yeah, absolutely.
Okay, and they can just call the number on the bottom of the screen and make an appointment.
Yep.
Do they need a referral? Not always or
Not usually,
sometimes?
but they can just go ahead and give a call. Most of
Yeah.
the time, if they do, then we can go ahead and reach out to their primary doctor to get one.
Awesome. Well, great job today, and please come back and see us.
Thanks for having me. Appreciate
You're
it.
welcome.